Welcome, everyone. I am here for a special edition of our Brighter Days Through Better movement as we help get you all moving better, being as healthy as you can in time for the summer solstice on June 20th. And how wonderful it is today. The sun is shining, and I see everyone having more and more hope as vaccinations increase and COVID numbers hopefully continue to decrease. But today I am really excited because I have a very special guest star with me, Dr. Curt Beckwith. Dr. Curt Beckwith, thank you for joining me.
Great to be here, Michelle. Happy I could help out today.
Well, I think it's really interesting because who would have thought there'd ever be a time when an infectious disease doctor and a physical therapist would actually need to collaborate and have a discussion, and how things change over the last year. So I think it's really exciting and hopefully gives us an indication of the collaboration that needs to continue to go on within the healthcare system in all different realms, not just to do with COVID and not just between an infectious disease doc and a PT. So hopefully this is setting the stage for the future. So let's start with hearing a little bit about your last year. The pandemic was obviously very challenging for everyone, both personally and professionally, and no doubt that your role in healthcare evolved a lot. Can you give a little brief overview of how your role evolved since the start of the pandemic to where we are today?
Sure. It's hard to believe, it's been just over a year since all of this started, and it's been a total whirlwind and a crazy year for everybody. So I'm an infectious disease physician. I work at Miriam Hospital, and I'm affiliated with Alpert Medical School at Brown University. I also work at Rhode Island Hospital. I do work at the Infectious Diseases Center and Immunology Center affiliated with Miriam, and that's an ambulatory healthcare center where we see outpatients, and we're doing a lot of work with COVID patients who've recovered and are recovering from COVID. But the last year has been crazy. The first, I'd say, 3 months of the pandemic, it was all about trying to understand the disease, understand how to manage it, how to prevent transmission, understanding how to control the numbers of people coming into the healthcare systems, which was really overwhelming, kind of March, April into May. And then as summer arrived, things settled down a little bit. But those first 3 months, everything we were doing was related to COVID-19. It was 7 days a week, 24/7 essentially, not only for infectious disease docs, but really many, many different specialties in the hospital, just trying to manage the surge that was happening at that time, trying to get a handle on how to understand the disease and how to prevent people from getting severely ill and dying from it, which they really were early on. Then as time went on, we started to get our handle on it. Better understandings of transmission dynamics, better understanding of how to manage people if they were severe enough to come into the hospital, what was working, what wasn't working. And then, maybe things felt a little bit better, and then the fall hit and things got tremendously worse again, frankly, worse than they were in the spring of 2020 in terms of numbers. The curve was 3 or 4 times higher in the fall of 2020 than it was in the spring. So nobody really expected that, but that's where we ended up. And now we're coming down off the backside of that second curve. Now we have vaccines available, so we're in a much different place now than we were. There's certainly light at the end of the tunnel. We're all very hopeful that if vaccines can continue to roll out, that we're really going to be, through this, but we have a ways to go.
What a roller coaster. And I know that there's many people listening that are trying to manage and get themselves to be as healthy as well as they can. As a healthcare provider, and especially someone who really was on the front lines, what were some of the, now I'm going to get personal, what were some of the things or techniques or habits that you did yourself to help you continue to be in a healthy place so you could be the best you could as a doctor?
Yeah, so some of the early challenges were really about staying well yourself.
Yeah.
There was so much fear about getting infected, particularly as healthcare providers. Every day you went to work, you were fearful that you were going to get sick or get exposed, get sick, and bring it back to your family. So a lot of the initial stress, I think, for anybody who is working in a healthcare setting, that doesn't have to be physicians, obviously nurses, people delivering food, people transporting patients, people working at desks, everybody was in a situation that was scary, and there were just so many unknowns to it. So I think it was a matter of kind of keeping your head to the task in front of you, paying attention to what you had to do, trying to mitigate risk at all levels as best you can, learn how to use PPE effectively, make sure you have access to all the equipment you need, which we did, which was a great thing. We never really ran into supply problems with respect to PPE. And then when you leave the setting, try to do what you can to mitigate risk when you go home and things of that sort. So I think a lot of attention was on those very simple things early on. But that was what contributed to significant stress, no doubt about it.
Well, kudos to you and everyone else who was on those front lines, because we're certainly well aware, or we can't really imagine how challenging it was for all of those really frontline workers. So we appreciate all the work that you guys did. And as we come off this sort of second wave, and as there is some hope, what are you looking forward to the most?
Well, it's a lot I'm looking forward to, like, traveling without risk, and just getting back to more of a normal life. I think in some ways we're getting there, but we still have a long way to go. And I'm hoping as spring and summer are upon us, it will get even better, just by the ability to be outside more frequently and things of that sort. But I really do see a light at the end of the tunnel. But every time we feel like we're closer, then you kind of take a step back at the same time. Whether it's the variants that are emerging, whether it's restrictions being eased very quickly, perhaps too quickly in some circumstances, whether it's vaccines not rolling out as quickly as we would like them to. So all the things are moving in the right direction, but at the same time, it's still swimming upstream a little bit.
Great. So looking at the journey you've been through, you've obviously learned a lot, you've had to deal with a lot. At this stage, do you think that, and this could be related to COVID or non-COVID, do you think you now assess or treat patients differently compared to what you did before COVID? Now, some examples may be, do you now add in, like, have you had COVID, and assess your normal patients in different ways? Or have you changed some of the questioning, knowing that everyone in our community has had to deal with a tremendous amount of stress and loss and fear? So any changes in how you provide healthcare?
I think so. I mean, this has changed really kind of everything we do, and at some level, some more than others. I think whether or not somebody has had COVID is very much a part of our evaluation now, on any level. And that could be directly related to COVID or indirectly related to COVID, but somebody's coming in with a concern for infection or sequelae of infection, and whether or not they had COVID is going to be very important into that evaluation. I think in a lot of ways, much of what we do has become more multidisciplinary. And specifically with respect to COVID, and I think we'll get into this, we're working with lots of different providers, lots of different specialties, but even just the approach to a patient, I think we're thinking more multidisciplinary, even if it's not necessarily related to COVID. And I think that's actually, a silver lining to a certain extent. We need to be multidisciplinary in our approaches to all types of diseases. And if we're getting there, despite it being through COVID, that still may be a positive benefit, moving forward.
Completely agree. So let's jump onto a topic that we're seeing a lot about in the news, and that is long haulers. Long haulers is a term that's used to describe the people who have these ongoing symptoms for 3 to 6 months. You hear it called long COVID, post-acute COVID syndrome. There's all different names. There hasn't actually been an official name given, not that I know of yet, but it could be wrong because things seem to change every single day with this. So, you're going to look at this differently to myself as a physical therapist. You're an infectious disease doc. So tell us what your thoughts are on this concern about long haulers or long COVID.
Yeah. Well, yeah, the name keeps changing, and I don't think we're going to probably settle on a name for a little while still. But all of the terms you mentioned are certainly accurate at this point. And the definition of what it is needs to be, worked out. There's a lot of research going into, we'll call it post-acute COVID or long hauler syndrome. There's a lot to learn. There's a lot of research that needs to be done. But we're kind of living through it, as we do all that work. We're seeing patients who are suffering from these prolonged symptoms. In my mind, I kind of think about it as symptoms that are beyond 4 weeks or 8 weeks from their acute infection and can extend any number of weeks or months beyond kind of those time points. It includes a variety of different symptoms, and some patients may have more of one than the other, or a constellation of symptoms. So there's no precise definition. It's kind of this grouping of problems that patients are having after they've recovered from their acute illness. And what I can tell you is, as we're seeing these patients, it can be life-altering, for many patients. It may cause them to be out of work for prolonged periods of time. It may cause them to have, stress and mental health challenges, some of which can be directly related to COVID, some of which could be just, coping with the long-term illness that they're having. And we need to develop multidisciplinary approaches that kind of tackle the different symptoms, focusing on symptom control, but also getting them back to a better quality of life, getting them back to a point where they're functioning at a higher level. So I think those are the ultimate goals. I guess what I would say is I think people do get better from the folks I've seen. It's often a matter of time, a matter of symptom management, a matter of being sure there aren't unexpected complications, which I think is pretty rare. And it's giving them the understanding and the optimism that this is going to get better. It's terrible and frustrating, but you will get there.
Yeah. Let's talk about some of the symptoms, and maybe we can chunk them together, because I know some of the studies, and again, when you bring up some of the studies, and I know they're all in preliminary stages, but you see them in the news, they talk about how you cluster these kinds of symptoms. I mean, I'll start off with, one of the most common ones you hear about, and that's this fatigue, this ongoing fatigue. When I'm going to think differently of fatigue and manage it differently as a PT, and this is where I think there's this great opportunity for this collaboration amongst different healthcare providers about how we work with these patients. When it comes to a physician or a specialist like yourself, when someone presents with fatigue, how do you think about managing it? I'm curious, just because as a PT, I'm going to look at managing it a different way, but maybe we do cross over. So what would be your thoughts on how to manage it? And
I think there's a lot of crossover, because, in my world, at least pre-COVID, if somebody was presenting with fatigue and there was suspicion that was from an infection, our job is to cure the infection, or at least wait till the infection is over, and then the fatigue should resolve. So that's how an infectious disease physician would often think about fatigue related to a specific, infectious disease. Now, what we're seeing is the infection is actually resolved from a virus standpoint, and people are being left with prolonged symptoms. Now, and there are a lot of theories as to why those prolonged symptoms are happening. It could be from direct effect of the virus, so damage caused by the virus. It could be from the immune response that they've gone through to eliminate the virus from their body. And it could be due to other things like clotting and hypercoagulation, and there are a lot of different physiologic effects from the viral infection itself that are probably contributing to these prolonged symptoms. Again, a lot of this needs to get sorted out, but the infection is gone. When I'm seeing a patient 4 months after with prolonged symptoms, 4 months after their acute infection, I'm not looking for virus, and I'm not trying to get rid of the virus, because it's long gone. It's really managing the prolonged symptoms that is still in the recovery phase for that individual.
And I think that's, where this collaboration goes on, because you see this ongoing fatigue and people question, well, why? And unfortunately, at this stage, we've got some different theories, but we don't really know what the reason is. However, we can still figure out as healthcare providers how to manage it. And with something like fatigue, it is a lot about managing your energy levels, looking at what you're doing during the day, ensuring you're doing the appropriate amount of exercise, and being very aware of not overdoing it, resting as needed, all of the ways you can manage it so you can actually function and have a quality of life. Fatigue.
Absolutely, I couldn't agree more. And this may be different than a lot of other diseases where, with severe symptoms, doing too much too quickly could be a bad thing. And it needs to be kind of a very measured approach and a gradual approach to increasing movement and activity, and eventually which will improve quality of life. But it's not, slam them with too much activity right at once.
And it's almost, I mean, as a PT myself, it goes against what we're often taught and what we're often encouraging people to do. We always say, like, yeah, do a bit more each day. Let's move more. Let's progress it. But when you're dealing with someone with fatigue, who ultimately, if you overdo things, can actually spiral and result in headaches and fevers and pain and other symptoms that impacts their quality of life, it's so much about this. We sometimes call it the 4 Ps in the PT world: planning out your day, pacing yourself, prioritizing. I mean, do you really have to do the dishes every day? I say no, but you may say yes, Curt. But every person is a little, and every family is a little different. And positioning, what positions, all the things you can do to manage that fatigue. So fatigue's a big one. How about some of the, I know that the psychiatric things are coming up, the anxiety, the depression, the fogginess, the cognitive impairments. These to me are a little bit out of my realm. So any thoughts on
they're classically a little bit out of my realm too, but we're definitely seeing them, and I think they're pretty prevalent in these patients. Fatigue obviously is very prevalent. Brain fog is something, we're hearing a lot about. And what that means is that somebody, since their acute infection, they've just not been able to function cognitively like they had been before they got COVID-19. They're having trouble concentrating. They're having trouble doing simple tasks that they never even would have thought about before COVID-19. They're having trouble sleeping. I think sleep disturbances are a big part of that. And then there can be either exacerbation or even new anxiety and depression, which again could be direct result of the virus and or due to the stress of the whole situation. So I think, people with those problems pre-COVID may be more likely to have problems in the post-COVID period, but people, who didn't have those problems are also reporting increased anxiety, increased depression in conjunction with the brain fog and everything else. So it really does create a very challenging situation for a lot of folks.
Mm-hmm. Some of the other things that I've heard patients describe of, and you may have heard, or people in the community, obviously the cardiopulmonary signs and symptoms such as ongoing shortness of breath, cough, chest pain, those things. And we're often seeing people needing to see the cardiopulmonary specialists in these areas, looking at if there's underlying pathology, questioning underlying reasons. We've touched on the psych, but there's also the neuro symptoms, some of the changes in taste, hearing, and even other sensory things. Tell me what your recommendations are to people who may be finding that they're suffering from some of these symptoms. What do you think?
Yeah, so I think shortness of breath is a common one. COVID-19 to a large extent is a respiratory illness, and patients who are hospitalized have a pneumonia. They have a viral pneumonia from COVID-19, and that can lead to persistent shortness of breath, or what we call dyspnea, and that can extend well beyond the acute infection. People with underlying asthma, people with underlying emphysema, they're going to be likely at higher risk for prolonged symptoms. But again, people without those underlying problems can also develop this. And referral to lung specialists, pulmonologists, is something that we're doing a lot. Similarly, referral to cardiologists. So there can be a lot of cardiac problems related to COVID-19, including clots. In rare cases, things like cardiomyopathy, where there's a global problem with the heart function. Those aren't necessarily common, but you want to look at cardiac function in the post-COVID period if people are having persistent shortness of breath, persistent chest pain or chest discomfort. Those are common referrals to both lung doctors and heart doctors, and then not only to physical therapy, but to, get primary care involved in rehabilitation medicine. And it's really this kind of multi-pronged approach. And which referrals an individual patient may get really may depend on what symptoms they're having. It's not like you have to see all these folks, but if you're really having a problem with shortness of breath, you want to focus in on that. If you're really having persistent chest pain, you want to focus on that. And I think the constellation of symptoms really varies between folks.
It's a great point, and I love the fact that you bring up the primary care doc, because I often call the primary care doc the quarterback. They're often the ones who's like doing that initial assessment evaluation and deciding, hey, which specialist do you need to see? Because you certainly don't need to see every specialist, because it really depends on the symptoms that you're presenting with. From your research or from your observations of the research, who's most prone to suffer from long haulers or deal with some of these post-COVID symptoms?
Yeah, well, that's certainly an area of active research. We need to have a better understanding of who's at risk. I think there is data that, again, underlying lung disease, heart disease, higher body mass index, so people who are more overweight certainly can have more prolonged symptoms and potentially worse outcomes, and people who are older. This virus has really impacted older folks. They are going to likely have higher predisposition to prolonged symptoms. But other comorbidities, cancer and diabetes and other things, I think it's still unclear how much of an impact those play in terms of long-term symptoms or prolonged symptoms.
And I think that's an area where I tell many people myself, I mean, we may see an orthopedic patient here at Performance, and they suddenly say, yeah, but when I exercise, I had COVID 3 months ago, wasn't so bad, wasn't a big deal. But every time I start to play with my kids, I feel really short of breath. And for us, it's like, oh, okay, we can help you manage that, but yet we still want to make sure your primary care doc knows. We still want to collect this information, because there's a lot we all need to learn about this, because we're sort of living this time and collecting the information and ultimately looking at it all so we can come up with the best plans for intervening, because we don't know what the next few years are going to hold in response to COVID.
Absolutely. So we've started a COVID-19 clinic at our center to really help with some of this kind of quarterbacking, as you say, which I think is a good term, because primary care has really been struggling with how to manage this. So it's not clear to them necessarily, like it isn't to anybody else. So we've started a clinic, and we're seeing patients with kind of, quote, post-acute COVID, long hauler COVID, to really just be a center point for evaluation and providing consultations to other physicians, other providers who are needed, and to work with primary care. So as we all kind of work through this together, I think it's been beneficial to our patients to have a place where they can go to kind of get that evaluation when others, may be reticent because they just don't know how to deal with it. And that's a big challenge. So not that we have all the answers, but we wanted to have a centralized place for evaluation and then for referrals, and I think it's helping.
Dr. Beckwith, how do people find out about that clinic?
So it's through the Miriam Hospital. It's through the Miriam Hospital Infectious Diseases Center at 180 Corliss Street in Providence, and so Lifespan would be the best source of information.
Perfect. Thank you so much for that. Appreciate it. Another question. So when we talk about this post-COVID and post-acute COVID, and again, I may be getting off in a different realm, but we've almost got these two buckets. We've got the people who are super sick and who were in intensive care, and anyone who's been in intensive care has the risk of having a lot of challenges, whether they're to do with the neurological system, cardiopulmonary, musculoskeletal, like there's a lot of things we have to look at. So anyone who's been really sick we're gonna have to deal with them, help them anyway with a multidisciplinary approach. But then we're also seeing this group of people who they may have had only mild or moderate COVID. They didn't actually have really bad, they didn't end up in the ICU or even in the hospital. Do you think these are two separate things, or do you think they're merging together, or you just don't know?
Well, you're right. There are these different groups of people. The people who were severely ill in the ICU, some of whom were in the ICU for many weeks. This isn't necessarily a 2-day stay in the ICU. For some patients, it could be 3, 4, or 5 weeks. So that's a very different person coming out of the hospital than somebody that had, say, moderate disease, but they were at home, they recovered, but now it's experiencing some prolonged symptoms. The approach to them may not be all that different, when you're 2-3 months down the road. It's really going to be still managing symptoms, trying to improve quality of life, trying to improve their independence. But I think for the patients with severe disease, they're probably looking at a longer recovery period because you have all the other factors that are independent of COVID that are going to slow down their recovery.
Yeah. So obviously, the post-COVID issue sounds like a problem and an issue, and it's believed there's different research coming out that anywhere between 50 to 80% of people may have some kind of symptoms to some degree in those months that follow. And again, there's different things coming out with different numbers. That should mean we all want to either avoid getting COVID. So obviously the ongoing vigilance with mask wearing, social distancing, etc., which I'll let you speak of from maybe an infectious disease standpoint about how those things work. But also then let's jump on to the other hot topic, and that's vaccinations.
Yeah, so you couldn't be more right. Yes, you want to prevent yourself from getting infected and take measures to reduce transmission in the community. And up until the vaccines, that was social distancing, it was using masks, and it was washing your hands and trying to, remove any virus that you may have come in contact with. So pretty simple public health measures, which are still just as important now as they were, a year ago, without a doubt. In some ways, in my mind, as we're trying to get vaccines up in terms of uptake, access to vaccines, we really want to stick with our public health measures because we actually have a solution to the problem. We just have to get to the point where enough people get vaccinated that there's an impact on transmission. We're getting closer, but we're not close enough yet where we can abandon all the simple public health measures. So I guess I would very much promote continuance of those until we're at a better place than we are now.
Yeah.
And then the most important thing outside of that is getting vaccinated. We have vaccines that are very effective, and we have vaccines that are safe. Understanding these are new vaccines, some of the technology is new. They're under emergency use authorization, which most people, didn't understand before COVID-19. That said, there is a lot of data to support their effectiveness and their safety, and it truly is our way out of this. So I'm vaccinated. I think you are as well, and I would very much encourage everybody to get it.
So I did just check this afternoon that here in Rhode Island, we have over 402,000 people who have had one of their shots and over 281,000 that have had 2 doses. So we're on that journey, we're on that way. What would you say to someone, I don't mean to put you on the spot, but that's okay, for the person who says, oh, these vaccines are really new, I'm scared of them, I'm a strong person, I'm okay with getting COVID, I think I can fight it, so why should I get vaccinated?
Yeah. Well, a lot of healthy, strong people have died from COVID. Just because you're healthy and strong you can't predict how it's going to affect you in terms of severity of the acute illness and whether or not you may have prolonged, long haul symptoms. You don't know that going into getting COVID. A lot of people are not sick from it, and the spectrum of disease is wide and broad, but in an individual, you just don't know what it's going to do to you or to people in your family. So I don't think it's worth that risk. Again, there's a lot of strong data behind the vaccines in terms of both effectiveness and safety. Talk to people who've had the vaccine, see what they think. I think the upside of the vaccine far, far outweighs the potential risks. And the potential risks of not being vaccinated, for sure.
Well said. I couldn't agree with you more. And thank you for that little public health announcement. And I hope it encourages our peers and family and friends and people in our community to trust in the science, because I honestly trust the science more than I trust COVID, because what we're seeing with long haulers and COVID, to me, that's scarier than a vaccine that's been researched and studied by some of the smartest people in the world.
I agree. And another question I've been getting a lot is which vaccine to get. Mm-hmm. And people seem to be focused on which vaccine. There are only 3 available right now in the United States. 2 of them are mRNA vaccines, the Pfizer and the Moderna. And then there's the Johnson & Johnson vaccine, which is kind of a more traditional vaccine in terms of how it works. What I tell people is don't worry about which one you get, just worry about getting it. They're all effective. We think they're all safe. And the quicker you get it, the better you're going to be, and the more impactful it is from a public health perspective. We're in a race to get as many people vaccinated as possible. So it's really about getting it done, and don't worry about which one you're going to get.
I know it may be complicated, but do you think you could give a really simple explanation about the differences between those two vaccines and the Johnson & Johnson versus the Moderna and Pfizer, like how they work differently?
Yeah, so the Moderna and Pfizer vaccines are called mRNA vaccines, which is really a new vaccine technology. And it's taking kind of pieces of the viral genome, genetic material, and it's putting that into the vaccine, which doesn't get integrated into the human's DNA, which is something people worry about, but that's not how it works. And then what that small amount of genetic material does is it induces an immune response from your body to attack the virus when you're exposed to it. So it seems to be very, very effective. Johnson & Johnson uses what's called an adenovirus vector, which is basically using a different type of virus to deliver a viral protein into the body, which then induces the immune response. Tried and true in terms of that vaccine technology. So we've got different technologies at work here, which I think is a good thing because it leads to multiple vaccine options. But as I said, I think both are highly effective.
And just to help me, I know the mRNA vaccine is new, but it's something that has been studied. It's not just new in the last year. It's been studied for years and years and years.
Yeah, no, this has been in the works for quite a long time. And then this was a significant opportunity to try this type of vaccine. And I think everyone's been, incredibly pleased with how it's performed.
It's great. Now, of course, some of us have those symptoms for a day after the shot, but that's much better than dealing with long haulers for many, many months or even years. So I think we can all put up with a headache or a slight fever for a day if we have to.
Yeah, and the side effects, and a lot of people don't even have them, but if you do, they're usually very transient and typically less than 24 hours. And I would say kind of, body aches, maybe a low-grade fever, some fatigue, and a sore arm, at the injection site is pretty typical, but they're pretty short-lived.
Yeah. I do remember you complaining about your sore arm, but I'm pleased it's feeling better.
Yes.
All right, so what next? The future of medicine and how we grapple with the challenges of COVID. I know we've touched on it with the vaccinations, we've touched on it with some of the studies, but what do you think the next year looks like as we continue to come off this pandemic and dealing with COVID-19?
Sure. Well, we need to understand post-acute COVID, long hauler syndrome, certainly much more, and how to treat it, why it happens, and get a better understanding. We need to continue vaccine development, and now with the variants that are emerging, will we be looking at annual boosters, revaccination? I think there are a lot of questions there. I wouldn't be surprised if we end up, having an annual booster type of scenario related to SARS-CoV-2, and we need to get back to life as normal as much as we can. And not that it's going to go away, but I think COVID will get to a level where it's not front and center, in our minds every day. Hopefully the majority of the population will have immunity through vaccination. Certainly many people will have some immunity through actual infection as well, but that will get it to a point where it's not gone, but it's more manageable. The risk to us on a day-to-day basis will be far, far lower, and it won't be kind of this, prominent thing in our daily lives like it has been for the last, year plus. So that's what I'm looking forward to, and I think we are definitely going to get there. But I don't think it's going to disappear altogether, in the future.
It's going to be what I think is going to be really interesting to how it changes us from a public health standpoint. I think we'll all be much more vigilant about using hand sanitizers and washing our hands, and will that change the spread of even flu and colds and things like that? And I've even questioned myself, is next time even if I don't have to wear a mask when I fly, I might just always wear one just in case.
I totally agree. I don't think masks are going away anytime soon. And there are reasons why they shouldn't go away now. But even when we're in a better place, I think our behaviors have changed considerably. And a lot of that will stick with people. Hand sanitizer, hand washing, use of masks. If you feel like you're in a situation where it just makes you feel more comfortable and safer, then that should be okay. And I think that's probably going to become, part of our regular life to a certain extent.
You'll no longer be the weirdo who's walking around with the mask on. You'll just be like, there's someone with the mask on, whatever.
That's right. We don't even notice it anymore, really.
No, exactly. Well, Dr. Beckwith, you have been awesome, and we really respect and admire the work that you and your team is doing and have done through the pandemic. I'm giving you the last 10 seconds, 10 seconds of advice. This is your chance to tell the world what you think and what you'd like them to remember you for.
Sure. Well, thanks for having me. So what I would say, if you have prolonged symptoms or long hauler syndrome, you're going to get better. That's number one. Number two, get your vaccine, whatever vaccine you can get, as quickly as possible. And don't throw away your mask quite yet.
Perfect. Thank you so much, Dr. Beckwith. I really appreciate it.
Thanks. It was great. Appreciate it.